In this video, I will cover X-linked dominant disorders, which includes hypophosphatemic rickets as well as Fragile X syndrome. So the first condition, hypophosphatemic rickets, is caused due to the resistance of renal tubules to the vitamin D. So therefore, the other name for it is vitamin D resistant rickets. So as a consequence of which, there is decreased absorption of phosphate and decreased absorption of calcium in the renal tubules, and thus these patients will develop hypophosphatemia, rickets and osteomalacia, as well as slow growth. The next condition is Fragile X syndrome, and after Down syndrome, which is trisomy 21, Fragile X syndrome is the second most common genetic cause of mental retardation. There are two mechanisms through which Fragile X can develop, and the first one is expansion of the trinucleotide repeats of CGG, and then the other one is by mutations in the FMR1 gene. So the first mechanism, CGG expansion, accounts for about 99% of the cases of Fragile X, versus FMR1 mutation, which accounts for about 1% of the cases of Fragile X. But in any case, these patients, as mentioned earlier, present with mental retardation, long face, large jaw, large ears, and enlarged testicles. In addition, they may also present with mitral valve prolapse. Now, the way I memorize all these findings is imagine an individual with a really long face and long ears, and then draw the body with big testicles, so huge testicles right here. So that's a drawing I use just to remember the features. So these patients present with long face, large jaw, large ears, and enlarged testicles. And that concludes our discussion.